females, it is advocated in which there is a pathological barrier to natural fertilization, such as suppose vaginal stricture is there, it is narrow, cannot introduce the particular copulatory organ. If there are tumors or prolapse, in such cases also it is advised that we must go for an artificial. Recently, the AI is more frequently in our country also, in other countries also, in Scandinavian countries, to avoid the transportation test. Suppose male is at Chennai and female is at it's a rare breed and at Chandigarh. So carrying female to the Chennai, it is very difficult and it is not cost effective. At this time, this particular semen can be collected without dilution also. We can transport because by air we can do it. So this is one most important advantage, and this is done in most of the Scandinavian countries because those are the small countries. Then it is reduction because of this. There will be reduction of the cost of the breeding. Therefore, AI is practically more profitable when male and female are at two different places. That is in two countries. This particular experiment already has been done in our country also in 1970. So it is done around 50 years back, and Deshpande et al. From India to Sri Lanka. To avoid the spreading, sometimes what happens, the male owner is very peculiar person, and he don't want to that male should get an infection from the particular female. So he says we should go for AI. That time also we are advocating AI. Similarly, by AI champion science, there was one very good dog, Labrador, Ginger. You must have heard in Bombay when there was a bomb blast. So such type of some males, they are rare. So in such cases also we can collect that particular semen, and even after death also we can use for AI purpose. In some animals, means in some males, if there is a too early erection of the copulatory organ, if it is erect, so he cannot make intromission, and because of this also natural copulation is not possible, and in that case also the AI is advocated, making intromission impossible because of the swelling of the bulbous glandis. That is, as per veterinary scientists, animal scientists, this technology should only be used in animals which are having, should not be used, which are having genetic defects. Because how long we are going to treat these cases? Generation, because these are genes which are responsible for all these things, stricture of the vagina, immature erection of the penis. So we don't advocate, but owners, they like particular male, particular female, and that's why we have to do it. Otherwise, it is not advised by our scientists. AI conception rate is very variable. If you see, it is from 30 to 90%. In cattle, it is, I think, it is not less than 50%. But here it is very variable. So many times our veterinarians, they fail because there are so many. The major factors affecting fertility are the fertility of the male. Sometimes males are subfertile and still we are losing. Still we have to use. And because of this also the conception rate is less. Then care with which semen is collected. In this case we have to observe lot of aseptic precautions. Otherwise it will be, AI means artificial insemination. It becomes artificial infection. So when we are collecting semen, we have to observe aseptic precautions. It should not get contaminated with any bacteria or anything. Skill of the inseminating technician. In large animal cattle, we are holding the cervix and passing the gun. So gun is going into mid cervix, body of the uterus, and then we are depositing. But here, as we cannot pass our hand correctly, we cannot hold. So we have to do insemination in the vagina. So sometimes it may not be placed properly, and it may get back reflex, and may be thrown out, and may not sperms may not reach up to that particular place, and there may not be particular fertility. Skill of the insemination, the fertile female and its management. Another thing. Everybody, all breeders, they think that animal when the beach is coming in estrus, when it starts breeding, that is considered as first day. And they think that ninth day she is entering into the estrus, and so they advocate 9th day, 11th day, and 13th day mating. And this 13th day, 14th day, ovulation occurs. So likewise, so but many beaches they don't follow this average. So ovulation can occur from 5 to 21 days. In some beaches it may occur 5 days, some beaches it may occur 21 days. So when we have to inseminate nearby ovulation, then we will get good conception rate. That's why the female fertility and its management is very important. So the doctor who is doing AI, he should do some test that I will discuss later on. As Fute, one of the very big scientists, he said that the AI starts with male and ends with the female. Therefore, we will start first from the male and then end with the female. Okay. So, for collection, in case of canines, you must have seen tie, locking. Why this is occurring? Because this particular copulatory organ of this male has got a facial bulbous glandis. You can see this particular bulbous glandis is there. So when it is introduced, when it is copulation, it is introduced inside, it gets enlarged. And over the particular bulbous glandis, this particular vaginal muscle they clamp, and because of that there is a locking, tie occurs, and it may remain up to 25 minutes, 30 minutes, or maybe 5 minutes, like this. So methods of semen collection, there are different methods of collection. But artificial vaginal method is one of the best methods in our large animal, cattle and buffalo, other. And then another is electric ejaculation, but it is very costly. It's very costly, and how many cases we will be getting in a clinic per year? So we cannot keep this. Requires a laboratory or like a faculty, colleges, veterinary, they can go for it. Electric ejaculation is very widely used in case of wild animals because they cannot be trained. We cannot go. So in this animal, in dogs, digital manipulation is one of the best method. One of the best method. So digital manipulation is commonly used everywhere, right from our country to America, Australia, everywhere, because it is very simple. Requires less equipment, no equipment, only the trained our doctor is required. No post-operation complication. Even after collection, you can collect within one day, 2 days, like that. No repeatedly this particular technique can be used. Useful for untrained dog. We need not have to train the dogs. So, and also superior to the AV method in case of. So digital manual. For this, what instruments we will require? For a veterinarian who is doing practice, he shall use limited, he has limited resources because he is not getting on and up on the cases, very limited. So I have used disposable syringe, 50 ml. This is a disposable syringe, wide mouth, and here the needle is there with that particular cover, and that can be used. And so in that particular syringe also, or you can use funnel, collection tube. This is another collection. You can use a beaker, and over a beaker also wide mouth, or test tube and with a funnel that can be used for semen collection by digital method. So it requires very limited equipment, digital collection. Semen evaluation is also done immediately after collection. What is the volume? Whether it is less or come minimum second fraction we require 0.5 to 2 ml. Then color, whether it is a dirty color, whether it is having a red color indicates there is some inflammation or some RBCs are there. Then pH we have to see whether it is 6.3 to 6.9 like that. So that is not, we are not checking that normally when we are doing AI. but this should be checked. Microscopic examination. Motility you can observe. Take a drop of the semen, put over the prostate and see under the microscope whether the sperms are moving or not. Whether 80% sperms are progressively moving or live or dead. Suppose if they are dead, then try. Then we need not go for insemination because they are dead. They cannot fertilize. So motility is also, and generally for artificial insemination, when we collect semen, immediately we require more than 70% motile sperm. Then only then we will get a good motility. And the normal percentage means normal live sperm should be more than 80%. Volume semen. In this canines, the semen is ejaculated in 3 fractions. First fraction, which is pre-spermic, no sperms are there, it is around 0.5 to 2 ml. Then second sperm fraction, sperm rich fraction, it is 0.5 to 1 ml. And third post-sperm, it is around 15 to 20 ml. It is watery. First fraction is normally clear, second fraction is normally white or creamy because it contains sperms. If it is watery, then there are no sperms we can assume. Then third fraction is normally clear, which is a prostate pH varies from 6.1 to 6.9. In India, the pH is recorded around 6.57. The prostatic fluid is 6.0 to 7.44. Mean is 6.8. Motility immediately after collection, motility is examined, and Diabetes and Bukeri 1993 and England from 1998, they stated that less than 80% progressive motility may indicate a reduction in the fertility. So sperm concentration in this case also, suppose if you see in our large animal cattle, it is 1000 to 1200 million sperms. 1000 to 1200. In case of sheep and goat, around 3000 to 5000 million sperms are there. Here 300 million to 800 million sperms are there. Usually we require 200 million sperms for a successful AI. So the head of the spermatozoa is bilateral flattened like a table tennis bat. England stated that normal dogs will have more than 80% morphologically normal live spermatozoa within each ejaculate. Other spermatozoa can often be seen to be adherent to macrophages and they are moving. This is sometimes we see, but sometimes we also get if the dog is more than 5 years age, so sometimes we may get erythrocytes also in semen. Normal, it's normal. Fresh semen, most artificial insemination is carried out using most artificial inseminations because in this particular canine practice we are getting very less cases or less people are coming for it. So we collect because that procedure is very costly. Better observe that undiluted semen had a survival rate time of 21 hours. Quite good. I have done in Mumbai. What happened? There was one dog was in a parade. And another dog was at Dahanu, quite around 40 kilometers away from there. So what I did, taking dog was very difficult. So not easy, it was a little difficult. So I collected the semen with the particular 50 ml that syringe. Then I put that particular plunger and pack. And at the room temperature, I carried that particular semen and I did the AI. At Dahanu, and there was a conception. So we can transport like this also because prostatic fluid is there. So volume also increases, nutrition also is there. So this particular second fraction is that it can be preserved up to 24 to 72 hours. Chilled semen, we get chilled beers. So like that, semen can be chilled and kept in a refrigerator for 48 to 72 hours by putting some diluents. Chills Segar reported first pregnancy in 1969 by doing frozen. This is a frozen semen system is very costly because it requires a lot of instrument, freezing. It's not very easy. It's very very costly. That's why in our practice in Madras, Sri Devi has done some work on this particular, but that has not taken that much impetus. It has not gone there. So freezing is possible. It's not very difficult. And the same procedure what we are doing for cattle, collection of the semen, diluting, keeping in the refrigerator for 4 to 6 hours, and then we are keeping on the vapors for 5 to 15 minutes, and then putting into the liquid nitrogen particle. So this is a very easy method. It's not very difficult, but only thing we will require lot of instruments which are very costly, and that is done in cattle regularly, and that is done by only government institute. Frozen semen bank, female time of insemination is very important. It's very important because it is not like our cattle. It is not like our cat. In cattle, progesterone level rises after ovulation, but here progesterone level rises before ovulation. So we have to see when that particular animal is going to ovulate, and for that we have to do vaginal cytology, and the sexual behavior of the exhibited by the particular female. Tail deflection. When you put your finger near the perineum of the vulva, and if you do some movement, the particular female, if she is in true stress, that means ovulation time, she will deflect her tail. That is also taken as one of the criteria for doing AI or natural mating. So this is also used. This is a vaginal cytology, very easy. We have to do it, anybody can do it, and for that particular thing, we have to take the Johnson's ear parts. They are pretty sterile one. Pass into the vagina, do the rolling, take it out, put on the slide, just do the rolling, and it will get dry, and then we have to do Leishman staining, and then you observe under the microscope, and when the animal is in a estrus proper, then you will get like these cells. They are dead cells. There is no nucleus. Their borders are irregular, right? They are called as corniferous. When you get 80%, that time we can do the AI, artificial insemination, and the conception rate will be very good. And along with this, we have to go, suppose this is very costly, we can go for a progesterone estimation that can be done by our human laboratories also. And when there is a first AI, when you are doing with a rich semen, first AI you should do when the progesterone level is more than 3.5 nanogram per ml. Then next AI when the progesterone level is more than 10 nano. For frozen semen, because those pumps are very, they are not means they have undergone a lot of stress. So we have to do AI nearby ovulation timing. So first AI should be preferably done when the concentration is more than 10 nanogram. This is peculiar in case of canine as compared to our cows. And second, when values are more than 18 to 25 nanogram per ml. So insemination technique, intravaginal, intrauterine insemination, we should do 2 minutes. Intravaginal insemination, this is very easy technique, and in our country intravaginal is popular. In this case we have to, whatever the instruments we are using in the artificial insemination for the cattle, that can be used. Sheet you have to use that sheet. Then here you have to lift the pitch. Our assistant will lift the pitch, will taking in between his legs, lift, and the vulva will be taken up, and then we have to pass the sheet what we are using for the AI in depth. Pass into means we have to pass like that male is passing the copulatory organ like this 45 degree, and then it. As you go ahead cranially as well, and then you just attach the syringe which is having the semen, and you have to deposit the semen. So before, when you are doing AI, that is this intravaginal semen, then you have to take, before AI the animal should be taken out, the animal should be made to urinate, and after AI, this is very important because animal should feel it is a natural, so feathering is done. So what we do, we pass our finger with the gloves inside the vagina, touch the dorsum of the vagina, and just this particular massaging 3, 4, 5 minutes. So what happens? She feels that it is a natural mating, and because of this she sucks the inside the semen, and because of this also we get very good results of conception. And after that 30 to 60 minutes that particular animal should not be allowed for sitting, it should be taken for the walk. So in India, intrauterine insemination is not popular because we have to go for laparoscopy, and that requires skilled personnel, laboratory, and by intrauterine insemination we can go for, if you are going for surgical, only once. So surgical insemination has that drawbacks. Then transcervical insemination is also done, but it is done without anesthesia. For that, Foley's catheter or Cook catheter can be used. Number of sperms inseminated, 200 million sperms are required, and so it is a very easy method, and that can be done with a very limited instruments. Thank you very much.
Thank you, Dr. Brade. Now the topic is open for discussion. Dr. Brade is himself doing a lot of insemination in the pitches.
Particularly part of the England market. Did you get micro and macro nutrient also play important role? Big part of
आपने जो प्रेजेंटेशन दिया, thank you. Whether micro and macro nutrient also play a very important role in that.
Yes.
There you not mention overall. There is very ecological part in that. Even in livestock, animal health, production or optimal production, the micro and macro mineral play a very important role.
Yes, is there. For ideal nutrition, there is no.
Even for human being also. So, any more query? Yeah.
Carry is in natural mating, the average survivability period of the supplement issues, sir?
No. Nobody has taken objection.